what we're planning to do today is to do some work around communicating messages. I mean, one of the things I think we've established clearly is that the program that Bobby delivers isn't known about. The main access point is via your GP, but you can't ask to be referred to a program that you don't know exists. So I think Bobby will send Tony the details of the program if anybody wants to be referred by their GP. One of the things that we want to do mainly today is to see if we can work up some messages to communicate that might be appealing to people, that might encourage people to access the service, and Tony's going to facilitate that in a bit. But one of the things that I wanted to do first is to share the main points of some research that Alex sent to us. There is actually a research document which I can send to anybody who's interested that Alex has sent us. But this is the kind of highlights, and I'm sharing this to inform the work that you're going to be doing in the next hour or so. So the obstacles, because we know that men aren't accessing the services, we've heard is 2 to 8 or something?
Well, 1 in 4, 1 in 5,
okay.
both locally and internationally.
So men aren't accessing the services equally, and black men in particular aren't accessing the services equally. So obstacles. Men may not know or care they have a weight problem. Men may be less likely to recognise that they've become overweight or obese, and less likely to consider their body weight a risk for their health. In fact, the issue about recognising that you've become obese is a universal one. It's one of those funny things in psychology that people are often not aware of it, and people are not aware of it in their children either, even though they're buying clothes that are much larger sizes. The idea of lifestyle change may hold less appeal for men. Men tend to have greater reluctance to make changes and may be more cynical about health messages. Being big may be regarded as a good thing by some men. Sociocultural influences encourage a larger, more masculine body. Men may feel awkward about joining weight loss programs. Men may regard weight loss programs as feminized spaces. They may also feel embarrassed about discussing their weight in a group, whether mixed sex or men only. Men may be less interested than women in dieting to achieve weight loss. Weight loss diets are perceived as less satisfying and less appetizing. It may also be that men regard dieting as a feminized activity. Men want to avoid looking too thin. Self-esteem and lack of time are also considered to be obstacles. A lot of these things you guys have raised actually in the session on Thursday. Benefits men may find more appealing, not just to focus on losing weight, but also improving shape and stamina. Reduced need for medication. One very male-specific outcome of successful engagement with an intensive weight loss program is a reduction in erectile dysfunction. Everyone knows what that means, don't they? Back to reduced need for medication. There is some evidence that you can resolve type 2 diabetes through calorie reduction, but apparently it's quite an extreme project. Not everybody wants to. What encourages men to take part and stay committed? Encouragement from a spouse or partner, active support from a spouse or partner and or other family members appears to help men lose weight once they are on a program. Spouses or partners participate in weight loss program together. Humour in promotional materials. Men who join weight loss programs are more likely to be motivated by personal health concerns. A formal diagnosis of obesity may be the tipping point for some men. A serious health scare and or hospitalisation are particular motivators. Humour, banter and camaraderie between male participants help build positive relationships within weight loss programs and promote adherence. Strict diets seem unpopular, and terms such as healthier eating and portion control seem to be more appealing to men. Well, and to me, to be fair. Where should programs take place? Weight loss programs based in the workplace and weight loss programs associated with professional sports clubs have proved particularly successful in engaging men. Although men prefer NHS weight loss programs to commercial, they prefer that programs should actually take place in community or workplace settings rather than in NHS settings. Some men may feel more comfortable in a men-only group. Where data have been collected, men seem to have done better in men-only groups than in mixed-sex groups. Again, this is just confirming what you guys have been saying.